Hi, I'm Anita Bracken. I am a nurse on the clinical team here at Infinitus. I'm with Divya, one of our leaders on the product team, and we have an exciting new announcement here at Infinitus.
Hi, I'm Divya F3, and I lead product for AI platform at Infinitus.
So Divya, we've announced Studio, we've announced Lens, and now we are launching Workflows. So from my clinical perspective, managing handoffs has been one of the trickiest things. When it doesn't happen properly, it can lead to a really negative patient experience, delays in care. And so I'm really excited to learn, how does Workflows ensure that we aren't just building the same broken handoffs, but with digital agents?
No, that's exactly it. So Workflows is what covers that gap. Healthcare organizations, they're getting better now at faster benefits verification, at more consistent prior auth status follow-ups, at outreach that scales. But there's still the problem of individual agents solving individual problems, and no one's covering that gap.
Okay, so tell me more about that gap and how we are owning it, how we are solving it, how we are fixing this issue with handoffs.
Yeah, so the breakdown usually happens when a task requires multiple steps across different systems. So the challenge is orchestrating that sequence of events. And, for example, an AI agent might have a great conversation with a patient, but what happens after that? Maybe a benefits verification is required, or, possibly based on specific coverage data, you need to follow up with the provider's office and have an AI agent talk to the provider's office. Now, through all this, you also want to ideally, provide good patient experience and send the patient updates as the process moves forward. But these aren't just simple call handoffs. They're interconnected process steps. And right now, most of those connections are either entirely manual or they're roughly stitched together across different systems. So Workflows threads all of those different, steps together in one continuous journey.
Yeah. That really resonates. I mean, a patient's journey is like a chain reaction of events, absolutely. I think about someone waiting for a prior auth, waiting to start treatment. And, that breakdown almost never happens at point A or point B, but, at that connection. And when that connection fails, then the patient ultimately pays the price with delayed care and a really frustrating fragmented experience. And it sounds like Workflows really solves that problem.
Exactly. So you can now define the full sequence. The AI agent handles the prior auth follow-up call. And then once there's a status update, Workflows automatically notifies the patient, sends the HCP an alert, and updates the record in the customer's, external system of record, all without a human touching it, in the right order and with full context preserved.
Yeah, amazing. So this is more than just orchestrating AI agents. It's really orchestrating the entire patient experience.
Yeah, that's right. So it's AI agents, human agents, automated process steps, API integrations, notifications, it's all connected. So you design the workflow and Infinitus executes it end-to-end. And, if something changes mid-journey, a patient doesn't answer the call, prior auth status comes back with conditions, the workflow can automatically adapt, so it never stalls.
Okay, wow. And so how does this fit into what already exists in our platform?
Yeah, so it's a natural evolution, really, right? Studio is your workspace. It's where you build your AI agents, your integrations, you map your workflows, and you can also test all of this out end to end to make sure it really works. Then workflows themselves, that's the engine. So, you're connecting everything to that one continuous journey. And then Lens, that's what gives you eyes on all of it. So you can track every single conversation and the entire arc of that patient journey at the same time. So essentially, Studio is where you build, Workflows is where you execute, and Lens is how you observe.
And who is this built for? Who should be leaning in right now?
Yeah, great question. So, it's for the teams who own the full patient or provider experience. So, heads of patient access, reimbursement, coordination, and it's also, digital transformation leaders who have heavily invested in AI, but still have manual coordination that's kind of holding the whole system together. And, honestly, it's anyone who takes a look at their tech stack and just says, I have all these tools. Why is this still so hard?
Okay, last question. We're 7 years into building at Infinitus. Why is this so important right now?
It's because the bar has shifted. So, just a couple of years ago, people were asking, can AI agents be used in healthcare? And now, fast forward and we're asking, can they work together? Can they coordinate? Can they own an outcome end to end without a human having to stitch it all together? So workflows is our answer to that question. And this is how healthcare organizations move from point solutions to true end-to-end care. It's not just about automating individual conversations. It's about choreographing that full arc. And with the 7 years of healthcare specific, data and trust behind us, I think no one is better positioned than Infinitus.
Yeah. Okay. Well, thank you, Divya. I know as a nurse and somebody who also consumes healthcare, needs healthcare, I am super excited about this and what it means for patient experience. And I'm also excited for our customers to see the difference.
Me too.